I have come up with another case in my clinical practice. When the case is too lengthy, patient is narrating number of symptoms one after another and you feel completely lost, confused and blurred out. You need a light for clarity. So this case is all about finding the clarity from confusion to clarity. When the confusion prevents recognition, we need some other dimensions. We have to look through different perspectives to understand the case, to understand the patient, to find out the precise remedy. So this video is all about finding new dimension, exploring new dimensions and perspectives to find the clarity, to find the precise remedy. This was a great learning experience for me that has broadened my vision and my understanding of Materia Medica. I hope you will find it helpful. So let us start the case. It is a case of 35 years old female and her presenting complaints are: first is low blood pressure. Every few weeks her blood pressure drops down to 100/60 or 100/70, requiring her to be admitted to the hospital. And they gave her IV fluids and then she feels better. This happens every few weeks. During these episodes, she experiences lot of exhaustion, fatigue, difficulty in breathing, palpitations. No energy left in her body to do any work. Physically, she feels exhausted completely and she just wants to lie down. Next complaint is headache and neuralgic pain, mostly on the left side of the face and left side of the head, in jaw area, nose area, orbital area, and little bit in the neck region, and shifting pain in left hand, in muscles, muscular in nature. And when the pain becomes intense, when the headache and neuralgic pain becomes intense, she experiences pain in both sides of her face and head. Right and left side, both sides are involved. Slightest jar or motion aggravates the pain and hence she lies down in standstill position. Next complaint is abdominal complaints. Unsatisfactory stools in morning. She does not feel satisfied after first motion and hence she has to go for second time. Flatulent dyspepsia, accumulation of gas in upper abdomen, burning in esophagus, water brash, bad taste in mouth and sometimes nausea. These are the symptoms of dyspepsia and GERD. Then profuse leucorrhea for 8 days after menses, which is acrid, irritating in nature and causes itching. Lipoma in left axilla, which is hard in consistency and slightly painful sometimes. And thermally she is chilly patient, sensitive to cold air, cold weather. So this was the case. And she was narrating so many symptoms one after another and I was noting down on paper. And I was feeling completely confused and lost. I thought how to solve this case, how to convert so many symptoms into rubrics. For me, it was not possible to solve this case with rubrics method, only with rubric method. And it was quite a turmoil for me. Then I asked her about past history, about past illnesses, which led me to find out the exact remedy. This was a turning point in this case. And the past history is, first is, she had recurrent UTIs, recurrent urinary tract infections. Once that infection had spread to one of the kidney, which led to the inflammation of the kidney. Right or left kidney, she does not remember. And the urine analysis showed increased number of pus cells, that is sepsis. The recurrent UTIs lead to sepsis. And second past history is recurrent abscess formation in right ear, only right ear, during her childhood when she was in 6th or 7th standard. And she had taken allopathy and the abscess formation was stopped completely. But later, whenever she would catch cold, there was a oozing of watery discharge from right ear. that led to the perforation of eardrum. Recently, she had tympanoplasty of eardrum of right ear, and now she cannot hear clearly with right ear. Hearing acuity is decreased. So this is the past history. And what we can understand from the past history is there are two things we can understand. First is she had a tendency for recurrent abscess formation. Recurrent UTIs lead to sepsis. And the second important thing is only right ear is involved. This symptom is very peculiar in itself, abscess formation in right ear only. So by considering these 2 points, considering the peculiarity of the symptom, I took only one rubric, and the rubric is ear abscess right. And you can see here there is only one remedy, that is the Carbolicum acidum. It is a single remedy rubric. I gave so much importance to this rubric because it covers the tendency of abscess formation, and it also covers the most peculiar symptom of the case, that is abscess formation in right ear only. I consider it as the anchor of the case, and holding on to this anchor, I refer different books to confirm the remedy. And I found very interesting notes in different books, which I would like to share with you. When I was going through different books and literatures, I found very interesting note about toxicology. Toxicological information is a data obtained during poisoning due to extra dose. The common name of Carbolicum acidum is phenol. It is a very powerful antiseptic and anesthetic agent and very commonly used during surgeries. That has led to the poisoning of both patient and surgeons. These experiences has provided number of symptoms indicating its medicinal use. From toxicology, we can understand two things. First is sphere of action of the remedy and the pathogenesis, or a disease state a remedy can produce. Hence, toxicology is one of the most important aspects of Materia Medica. The Carbolicum acidum produces a languid state. Languid means a state of disinclination to physical and mental work, a state of exhaustion, prostration, fatigue, which is a very common theme of every acid, exhaustion and prostration. It is a painless, foul and destructive remedy. All discharges are very acrid, putrid, irritating and foul in nature. Very good remedy for leucorrhea, which is very profuse, acrid, irritating in nature and causes itching, just like creosotes. It produces a malignant and septic state. A physical exertion brings on abscess somewhere in the body. Physical and mental exertion is a causative factor in every acid. But in this case, what is peculiarity? Physical exertion brings on abscess somewhere in the body. So the abscess formation and sepsis formation is a tendency for patient in Carbolicum acidum. It also covers the past history of the patient in this case. Some patient has different tendencies, like tendency for chronic diarrhea, tonsillitis, recurrent glandular inflammation, or hemorrhagic tendency. But in Carbolicum acidum, tendency is for abscess formation. It produces malignant and septic condition. Carbolicum acidum has a marked action on central nervous system. It produces paralysis of sensation and motion. And it also produces a state of stupor and collapse. In cases of collapse, you can compare Carbolicum acidum with veratrum album. And it produces feeble pulse, depressed breathing due to paralysis of respiratory centers, and death due to paralysis of respiratory centers. It depresses the respiratory centers. It is a very good remedy for migraine, headache and facial neuralgias, which is better by tea, smoking or tobacco. Or you will find a very strong desire for stimulants in patient. Next is, it has a marked action on mucous membrane of stomach, esophagus, throat, mouth, intestines, etc. Mostly the upper GI tract. Burning pain and heat in esophagus, in throat due to water brash. Fermentative dyspepsia causes bad taste in mouth. A very good remedy for dyspepsia. Flatulent distension in abdomen and stomach. Painful flatulent, very good remedy for flatulent colic. Painful flatulent often mark in one of the part of bowel. Constant belching, nausea, vomiting, and very good remedy for nausea during pregnancy. And it is a remedy which is very destructive in nature. Very good remedy for malignancies of stomach, esophagus, throat and mouth. Then another sphere of action of this remedy is heart and blood. It also covers the circulatory disturbances like low blood pressure, which is associated with exhaustion, prostration, difficulty in breathing and palpitations and feeble pulse. A low blood pressure is related to the circulatory system, that is heart, blood and blood vessels. The another important symptoms that I found in Clark's indigestion is that it is a very good remedy for nervous dyspepsia. You will see the symptoms of migraine, headache or facial neuralgias are simultaneously present with the symptoms of dyspepsia or GERD. You will find these two systems are involved, central nervous systems and GIT, or they are strongly interlinked. It also covers the symptoms of pharyngitis or rhinitis, sinusitis, urethritis, and a very good remedy for anaphylactic shock. Thermal salt, patient is chilly, sensitive to cold air, cold weather, and slightest jar and motion aggravates the pain. That is modality. The another important symptoms that I found, and I asked her just to confirm the remedy. I asked her, have you noticed your sensitivity for certain odors? And she replied with lot of energy and emphasis. She said, yes, my nose is very much sensitive to all kinds of odors and smell. I capture any kind of smell very quickly and acutely. So this was another confirmatory symptom for me. That is increased olfactory sensibility. A very marked acuteness of smell is a very strong guiding symptom of Carbolicum acidum. And the another confirmatory symptom that I found is, in this case, this female patient has an inclination or a desire for tea, especially after lunch. A desire for stimulant is another guiding symptom for Carbolicum acidum. From this case, we can understand the different dimensions or perspectives to understand the case, to find out the remedy. The first is the past history. When we cannot find anything in present, we should go in the past. Next is the tendencies. We must understand the tendencies of the body. What kind of tendencies patient is carrying. In this case, the tendency is for recurrent abscess formation. Next is toxicology. It is a very important aspect of Materia Medica to understand the remedy, to understand the case. We can understand the disease state of the patient with the help of toxicology. Next is sphere of action of the remedy and which systems or organs of the body are involved. There must be a similarity between these two. Next is piculiargeneral of the remedy. Means a general disease state or a pathological state a remedy can produce. In this case, Carbolicum acidum produces a state of exhaustion, prostration, stupor and collapse, a state of paralysis and painlessness. Next is guiding symptoms. In this case, the guiding symptom is increased olfactory sensitivity and a desire for stimulants. And last is thermals and modality. Patient is chilly, very much sensitive to cold weather and cold air. And modality is pain is aggravated by slightest jar and motion. When we cannot find a remedy or cannot understand the patient, these are the few dimensions or perspectives we can use to understand the case to find out the remedy. It is not possible in every case to find out the remedy with the help of rubrics only or to convert every symptoms into rubric. And one important point that I want to share is that when we take only one or two rubrics from the entire case, one must remember that this rubric must cover the most peculiar symptom of the case. And after finding the remedy, our job is to confirm the remedy by reading different books. Then and then only we can surely prescribe the remedy. I gave her Carbolicum Acidum 30, and after 2 follow-ups, I found that she is improving symptomatically. Still, she is under my treatment and doing well. So this was the case. I hope you have understood the message I want to convey. Thank you for listening.